Welcome to Mental Health Helps, where we heal, educate, listen, prevent, and support through conversations with experts, activists, and people's personal stories. Welcome to Mental Health Helps. I'm Brandy Vega. Today we are joined with Clint Peterson. You are an APRN at Wasatch Behavioral Health, and help us understand what that means.
Correct.
Because it's not apron. You might think that.
Don't add extra letters. APRN is an advanced practice registered nurse. So I have a graduate degree, nursing degree. Mine specifically is in psychiatric mental health. So I'm board certified as a psychiatric mental health nurse practitioner.
Okay. And why is this kind of important to know? You were saying, some of the differences when you're working with people, you might want to know which certifications they have.
Right. So a lot of people come into treatment for the first time and they don't really know who they're meeting with. Are they meeting with somebody who has a certification? Are they meeting with a professional? Do they prescribe medications? Do they do therapy? My track of schooling was in nursing specifically, and then I specialized in mental health. And, somebody else might go through social work and become an LCSW or an MFT. Somebody else might go the medical route and become a psychiatrist. And so there's a lot of overlap in that all can do therapy, but not all can prescribe medications.
Okay. And so as somebody coming in, you would want to know that, who you're dealing with and working with, right?
Right. And a lot of times in my position, I do mostly medication management. I do some supplemental therapy, but the bulk of their therapy should be with an LCSW or MFT.
Okay.
And I try and encourage that. And so sometimes it's hard to hold those boundaries, those lines of, hey, this is a medication management appointment versus this is a therapy appointment. And I find that they often go to their therapist to talk medication management. And it's just a confusion of who am I talking to and what is their specialty.
Yeah. Okay. That's really good to know. How did you wind up in this position? What's kind of your background?
When I went into nursing, I never thought I would go into mental health. I think a lot of nurses say that. And I didn't realize how much background I already had in mental health. As a teenager, I actually took care of my great uncle who had Alzheimer's. And I lived with him and I took care of him. So I had a good nursing and mental health background. I didn't realize it at the time, right? So when I went into nursing, had a friend convince me to get a job at the state hospital. And I started working there and I loved the population. I loved working with people that I saw getting better. I saw them going back into the community. We did fun things together. They were normal people who happen to have this illness that most people don't understand, and I just really fell in love with it. And so I decided to keep going to school until I had this degree,
And are you glad you did that? Do you still have that same love and passion for what you do?
Totally. I would not do any other kind of nursing. I can't imagine myself in any other kind of role. I really feel like I'm doing what I'm supposed to do.
What has been maybe your best experience? Is there one story that stands out? One person?
Not any one person, but I love the little wins that we get frequently. I've seen people completely change their life around and do things that I was just totally blown away from. And I've seen people struggle too, and both can be rewarding in their own way. You don't want to see people struggle, but it's awesome to see their resiliency and building through that path of struggle.
What kind of people are in mental facilities? Who do you see? Because some of us just go, unless you've been there, you just go, man, it's probably just a bunch of crazies.
Yeah, there's a lot of misperception. So I guess it depends on what kind of facility we're talking about. My primary job is with Wasatch Behavioral Health, and I see outpatient. So somebody who's just out in the community who needs some medication management, some therapy, sometimes some case management. And we have some other supportive services depending on their level of needs. So this is somebody who maybe needs to check in once a month or maybe even only a couple times a year. Mm-hmm. And hey, I need refills on my medications or I need some adjustments. I think the core of your question really seems more like who might be like in a state hospital or in a psychiatric mental health hospital, inpatient. The majority of those people are somebody who's had suicidal thoughts of harming themselves or harming others, and sometimes they've had psychotic breaks where they're feeling paranoid, delusional, not safe, or their family doesn't feel safe with them.
But I guess then my question would be, we have a stigma. We know what we think we know or what we see. You actually see them. I mean, you worked in the state hospital. You see the person. What kind of people are these?
Legitimately, most of the people you could run into throughout your day and you would never know they had a mental health issue. I think that the human experience is going to expose us to multiple mental health issues throughout our lives, and it's a lot easier to see that in somebody else when they're doing behavior that's abnormal compared to seeing it in yourself when you might be struggling in whatever way. And we see a whole range of people. I mean, my youngest client at one time, not currently, but at one time was 4 years old. My oldest was 94.
Wow.
So a whole range of people, and pretty much any mental health disorder in the DSM has been covered. I don't know if there are any that I haven't covered, maybe haven't worked with specifically to specialize in, but we get a wide range.
Do you think that there's a stigma regarding mental health?
Definitely. I think the biggest challenge with stigma on mental health is self-stigma, actually. I think it's a lot easier for people to tell somebody else they need to stay on their medications. They need to get therapy or treatment. It's very, very difficult to do that for yourself, to accept I'm the one that needs the help right now. Mm-hmm. And that's where a lot of the stigma comes. Certainly Hollywood adds to that. Inpatient, there's tons of movies and stuff out there that just don't portray mental health accurately.
So what can we do to shift that?
This is mostly about learning your own thought process, about checking yourself, misconceptions you may have, beliefs that you may have that may be not rooted in reality. Mm-hmm. And it's an interesting subject because we're talking about people with mental health issues who sometimes those issues are because they have beliefs that are not rooted in reality. And I'm telling pretty much everybody right now that I guarantee you have beliefs that are not rooted in reality, but you just might not realize it or identify it yet.
So you've been doing this for a long time. You've worked with a lot of people. Do you think it's fair to say that almost everybody has some form of mental health issues?
Yes, certainly. And there's a difference between having mental health issues and having a diagnosis, something that meets the DSM criteria mm-hmm. for a diagnosis. A lot of us go around subclinically, struggling in our life. That's a human experience, right? We're supposed to have a full range of emotions, from grieving and severely depressed, anxiety, to really happy. Yeah. Maybe some impulsiveness, maybe some just odd things that come up in our life. But generally, we don't need to seek treatment for it until it starts to affect our life. When it starts to affect our families, our friendships, our work, school, that's usually when people start to seek treatment, because they know they can start to see the impact. If it's not impacting those areas, they're probably not going to seek treatment no matter how severe the symptoms are.
Do you think that it's changed, like our culture and our perception of self-diagnosis? Like we can just get on the interwebs and the Googles and just look it up and say, oh, I must have PTSD, I have anxiety, I have depression, because I know my teenagers, when I was their age, I had a lot of the same things. And my mom said, yeah, you're scared, you're sad, you're upset, suck it up, move on. Mm-hmm. And now, my kids come to me and say, I have depression and anxiety. Right. Like, here's my pass. Do we see that more with self-diagnosis? And if so, how should we address that?
Yes, we definitely do. There's been a trend going through like TikTok where kids will watch videos of, say, somebody who has Tourette's syndrome. And they will start developing tics because they've watched so many videos of this happening. Mm-hmm. And certainly we see it in many, many other areas. If you read about depression, if you read about anxiety, it's really easy to identify with that. Yeah, I've had changes in my appetite. I've had changes in my sleep, motivation level, energy level, depressed moods that have lasted for over 2 weeks. It's really easy to fit into one of those categories. And, some people like the label, maybe as a pass, as, hey, I have this, so I need extra help. Mm-hmm. Some people do fine with just, yeah, I am sad and I can just kind of buck up and go about my day. So everybody has a little bit different path. And I think the most important part of how we approach it is by allowing people to have their path and encouraging that path towards recovery, specifically their defined recovery, not mine or yours or their family members. And that's one of the really difficult areas of here. That
is hard. I know as a parent and as a friend, the pandemic has been really hard. People are feeling certain things. When do you know, or what advice would you give us to go, okay, instead of just a self-label and something you're dealing with, it's an actual problem. So If we're looking in at our children or our spouse or our friends, when would we need to say to them, hey, I really think you should get help, or take them to get that?
Yeah. This is a difficult question because part of the answer is you probably shouldn't tell somebody that they should get help. But if they ask you for your opinion, or you're in a parenting position where have this influence, mm-hmm. then you should guide them towards that. For the most part, it would be doing a check-in with yourself and am I all right?
What does that check-in look like?
It would be, really just introspection. Introspection is a hard thing in our world. We have so many things going on mm-hmm. that we rarely stop to check in with ourselves. Am I on the path that I should be on, that I like, that I enjoy? Am I hanging around the people that I want to hang around? Am I reaching goals that I want to reach? And if you can't answer those questions, then you really ought to back up and go, okay, what are my goals? What is my path? And if you're trying to guide somebody else who has, for example, I've got teenage daughters, mm-hmm. right? The goal for them, my goal for them, and luckily their goal for themselves was get through high school. I've actually got one in college now and one still in high school. And it's amazing watching them set their own goals at this stage. And there have been times when they've reached out to me and said, I need some help with anxiety issues or other things that come up in life. It's rare. They don't like to do that. Teenagers don't like to do that. So when they do, it's a really good time to listen to them and try and help them as much as you can. A lot of times when you offer the help or even just hold some space for them to vent whatever it is that they're venting with or to validate their emotions, mm-hmm. a lot of it clears up on its own. and that's great if that happens. If it doesn't, if it sticks around, I think it's okay to say, hey, these are some options. Would you like to see a therapist? Would you like to do a different recreational activity after school?
That doesn't involve drugs.
Right, exactly, or would you like to get on some medications, right? And differentiating between medications and drugs, because we often have an overlap in our discussion about, hey, you're on drugs for depression or anxiety, and it's like, okay.
Well, here's a personal question for you. My daughter is on medication, but she misses it a lot.
Oh, yeah.
And it's hard because, you try to force somebody to take something, but then they just don't. And so when I notice her moods change, I'm like, have you been taking your medication? Well, no. Like, how do you recommend for parents in my situation getting our kids to actually do what they're supposed to do?
The recommendation and actually doing it can be difficult for what it's worth. I've been in a similar situation, and my recommendation isn't always what I do.
Right.
Okay. So my recommendation, first of all, is to get a weekly pill box. It's a very old person thing to do. We have that stigma of that.
I do that every night.
Right. And set it up each week. And it's good to set that up with the kid so that they can have some accountability and putting that in there together.
Okay.
And then from there, you can decide, depending on how responsible your kid is or how much more you need to be involved, of encouraging, or it's really tricky because there's definitely a balance of, did you take your medications today? Which is another way of saying your mood is not very good.
Why are you so salty?
Right. And somebody who has to take medications to help regulate their mood does not want to hear, did you take your medications today? Whether they have or they haven't, it really invalidates their emotional experience at the time.
Okay.
So if you set up that weekly pill box with kids, then you can check in at the end of the week if you're giving them the leeway to give their own doses throughout the week, and go, oh, I noticed that you missed 4 times out of the last week. What's going on? Is there any way that I can help?
Okay.
Maybe we need to set a reminder in your phone. Maybe we need to just do a check-in at the end of the day or the beginning of the day if they have morning meds or evening meds or afternoon meds,
So maybe giving them the trust, but also making it easier for them to succeed and have accountability.
And accountability, it's huge because they have to have that buy-in. Yeah. I fully believe in that nobody should put something in their body they don't want to put in their body. There are very few limitations to that. If they're court ordered to take medications, then we're having a different conversation. But that is such a small percentage of the population, even in mental health. Even in psychiatric hospitals, very few of them are actually court ordered to take medications. It's still their choice.
Okay, that's a good reminder for us. And what would you say are the top clues or signs to look for if somebody is feeling depressed or suicidal, like dangerous type signs for not just children, but again, your friends and family? What should we look for? Yeah,
it's a very difficult subject and a very personal subject, I know, to you.
Right.
And my story as well. I've had family members who have expressed that they've had suicidal thoughts, and I've had family members who have had suicide attempts. And I've had patients who have passed away from suicide. And it is a very, very serious and difficult thing to approach.
Right.
A lot of the time, we can't see it. When we can see it, when they're actually opening up about it, it needs to be taken seriously. And I think that this is where that stigma question comes in. A lot of people don't know what to do.
Right.
And so they do a lot of things that really egg it on unintentionally.
Okay.
One of the worst things that you could say is you're being manipulative, or fine, you're going to go ahead and do that. You do it, you know, I can't control you, or you keep saying that, but you're not serious.
Okay.
And, you know, if you can take all those things out and instead get into a space where you can have a lot of grace and compassion for them, and realize that if somebody is in a situation where their mind is telling them that it would be better to die than to go on living feeling what they're feeling, you know, that can really change your interaction with them. Sometimes it's hard to see. So really looking at some of your question was, what are you looking for? It would really be, are there changes in sleep patterns, eating patterns? Are grades dropping? Are they changing friend groups? Those types of things. And if they get closer to planning an attempt, it might look like giving away their belongings, saying goodbyes to people, reaching out to people maybe they haven't talked to in a while, just to kind of do a check-in. Hey, I really appreciated you in my life, sort of thing, which might be a goodbye. And those are red flags that a lot of people miss because they're not doing them overtly, you know. And interestingly enough, a lot of them, their mood really improves right before
once they make a decision.
Suicide.
So if we notice that, how do you propose we respond to them? Is there a better way that you've seen that's more successful in helping them?
It's going to be different based on the person, your relationship level with the person, and how much influence you have in their life. But on each of those levels, it is about taking time out of your day, your life, your schedule to dedicate to this person of, I just want to be with you. I don't want to change your mood. I don't want to do anything else. I just want to be with you. Or I want to empathize with what you're going through. I have time for you. Those types of actions can be very powerful and, you know, help them see their worth in your life. A lot of people disengage with somebody who's dealing with mental health issues because sometimes it's really hard to be around somebody who's a downer.
Yeah, it's exhausting.
Always complaining, or and it can be exhausting physically, emotionally. And so if you feel exhausted just being with them, imagine what they might be feeling living that life.
And that's what we've had to kind of go through, you know, both of my daughters too. I have almost 20-year-old and a 15-year-old, and it is exhausting sometimes. And you worry, am I doing the right thing? Am I noticing? Are these typical teen behaviors because we missed some stuff? But, you know, I was talking with someone who was also going through a difficult time with their child. And, you know, I said, I'm just going to err on the side of love. I'm just going to, it is exhausting, but you don't get to not be a parent. You have to be there.
Yes.
And I'm just going to choose love, and I'm going to choose kindness, because what's the alternative? And if I'm wrong in giving them as much love as I can, I'd rather be wrong that way than, you know, trying to be harder or less understanding. And I guess that would be, I mean, what's your opinion on that? Like, when you don't know, just...
That's an excellent approach. But what I have to ask about that is, what does love look like? How do you show love? How do they feel love?
Yeah, time.
Time is one of the really important parts of love. You know, what you spend your time doing really is what you love.
And just trying not to get frustrated or angry, because it is exhausting. And it's like, I've taken you to counseling, I've got you medication, I've given you, like, I'm doing everything I know how to do. And if it's still not working, you kind of just go, I don't know what else to do.
Yeah.
And, you know, sometimes you do want to be like, just get it together. Like, it's not that hard. Your life is actually good. Yeah. You don't know what a hard life is. Let me tell you about mine. And so it is kind of hard. And you just almost have to, for me anyway, put all that aside and just be present. Just listen to them and not try to give advice, but just acknowledge their feelings and say, I'm sorry, that must be really hard.
Yeah.
How can I help you? What do you need? And I don't know if it's working or not. It seems to work for a while, and then, you know, we have another setback and you just go, okay, I hope I'm doing it right.
Yes. You brought up a lot of really good things in that. And it's really interesting looking at it from this perspective of, give yourself plenty of grace, because you're going to get frustrated, you're going to be human, you're going to struggle with this.
Right.
You know, and so it's okay if some of those things happen, if you turn around and own them. Hey, I got really frustrated with you, that's on me. And modeling that behavior of, I know you're struggling. Sometimes I struggle watching you struggle. Because there's a lot of projection that happens. Mm-hmm. Let me tell you how hard my life is, right?
I was uphill both ways.
That's why you're angry or frustrated, or, you know, you want them to make the choices, but you can't make the choices for them.
Right.
So like you went back to, after all that frustration and anger, is coming back and realizing, okay, this is about them and holding that space for them, and how can I support you? This sounds really difficult. I just love you. I want the best for you. Sometimes that comes out in ways that I don't intend it to, that aren't always helpful. So how can I be helpful?
When we're going through this process, sometimes we don't even know where to start. If we're noticing these things with our kids or our loved ones, where do we start? What's the process?
So start by having the discussion with them. You know, hey, I've been noticing you're not sleeping as well. You seem to be, you know, struggling more. You've been picking on your sibling more often, or, you know, kind of talking back to us. Hey, let's start with that, and what's going on. Know that I love you. And it's tough for the person in it, and so giving them a lot of grace. As a teenager, I did not want to open up to my parents. No way. I was not going to tell them what was going on in my life. Right. If they found out, it was because I messed up in hiding it, right? And as a parent, I know my kids can tell me literally anything, and I am still going to love them. There is nothing that they might go through in their life that is going to stop me from loving them. And that doesn't mean that they don't want to keep their stuff. And that's okay, and giving permission for that. Right. Hopefully they can open up from time to time about what really is going on. But once you identify it and they say, yeah, I need some help with this, you know, really trying to take a holistic approach. Hey, what can we do at home to make this better? Can we change diet, exercise, sleep? Can we go in and talk to your teachers at school? Maybe we can, maybe we can't. Maybe those are not the issues. Do you need to get in to see somebody, a professional, to help you work with this? And earlier we kind of talked about does everybody have some mental health issues? Everybody has mental health issues. They may not have mental illness, but they have mental health issues. And working with a good therapist can really be beneficial for anybody. Even if they don't have a diagnosable condition, they can help you get to that next level of your life.
So first, step one, talk to them. See if you can implement changes at home and make things happen, if they want to talk to a specialist or a therapist, set that up. One of the issues we ran into is we waited 3 months to get in, and she attempted a week before her appointment.
Yes.
And this is kind of an issue that I see a lot of, is like, I can't get in. There's too much. Are you seeing that as well?
Definitely. And it really is one of the difficult things in this field. I'll be honest, not a lot of people want to go into mental health. Not a lot of people want to work in that field. I have a passion for it. I was lucky that I found my passion at a fairly young age to work in this field. I work with a lot of other nurses. Most of them say, I don't want to work psych. I want to work ICU, ER, labor and delivery.
Puppies and unicorns.
Exactly.
Rainbows.
I guarantee every single one of those nurses works psych.
Yeah.
Whether they admit it or not, they do, And so the issue is access to resources, therapy, med management, that kind of stuff. When you're seeking this, reach out to as many places as you can. Get in touch with your insurance, see who's covered on your insurance plan, see who's not covered on your insurance plan. Call, text, email as many different places as you can. Find out their wait times, how soon you can get in, what's the cost going to be like. Look at their online profiles, see if they might line up with your belief systems, that type of thing. And it's really just testing it out, testing the waters. It might be a 3-month wait at some place. It might be a 2-week wait at another place. There might be a reason for that, but maybe getting in and seeing somebody sooner and then switching would be, a better route.
So you have options, but like if you're noticing that, hey, this is bad, we can't wait, then what?
Okay. So if somebody is a threat to themselves or others, it really is a good time to consider inpatient hospitalization. And that's one of the really scary steps as the person going through it, or the loved one of that person, the parent, spouse.
Yeah, that was
friend.
Hard for us.
Yeah.
We didn't really have a choice. Right. I mean, maybe we did, but it didn't seem like we had a choice, because my daughter spent 3 weeks in uni or at the Huntsman Mental Health, inpatient.
Yeah. What was your view before she went in of what that would be like for her?
I don't know. I mean, I guess I had never really thought about inpatient mental, facilities and care. And my daughter, we're prideful. It hurt because you feel like a failure. I didn't want to talk to people because I felt like everybody's going to judge me and think maybe I'm a bad mom if your kid has issues. But, I guess it's just the stigmas, the things you see or the things you hear. You think of a nut house or, whatever sort of words they want to use, that this is where people who are really messed up go.
Right.
So when your kid goes there, and then you see the other kids there, and then you see their parents there, and then you hear the stories, it changes everything.
Yeah.
And all of a sudden you realize that these are the people we love.
Yeah.
They're not.
Yeah.
It's hard. It's hard.
Very, very difficult.
Right. Sorry. I just think a lot of people don't understand. And
definitely,
I was so scared to leave her.
Yeah.
But I was also scared to be responsible for her at that time, because she almost died under my care.
Yeah.
So it's been great for us. It's been great. And I highly recommend it for anyone who's going through it. And I've actually had some adult friends, executives, business owners who have had mental health issues, and they've checked themselves in for 2 weeks to 2 months to 6 months. And all of a sudden, I look at these people and go, I would have never thought that.
Right.
So it definitely does change the stigma for me, but I don't know how we relate that unless you've been there. Sometimes you just can't even imagine what it's like and who's there.
Probably because you're not going to think about it until it impacts your life.
Yeah.
You know, if this was a physical issue, you wouldn't hesitate. Your kid breaks their arm, you're taking them to the emergency department and having it set, right? If they're more, hurt physically, you're going to see it and you're going to seek treatment for that. And there are a lot of resources, way less stigma. Nobody gets mad at you for breaking an arm.
Right.
But because it's a mental health issue, there's the parent shame that you kind of talked about, worrying about how people are going to view you. Mm-hmm. Yeah, it's good. Acknowledge it and kind of go, yeah, that's mine. I'm going to own that. If somebody else wants to shame me for it, then that's theirs. That's going to be theirs.
And that's part of the reason we're having this conversation, Clint, is because I need people to know it's okay.
Yeah, totally.
It happens to all of us, no matter your race, your background, your wealth. Like it doesn't matter. Mental health and suicide doesn't discriminate.
Right.
But we can't be afraid to talk about it. We can't be ashamed that, hey, my daughter struggles, or I struggle, or...
One of the best things you can do is talk about it. They've actually done studies on this to see if talking about somebody's suicidal thoughts increases the risk for suicide. It doesn't. It actually decreases the risk for suicide. It shows that you're willing to go to their level and understand them rather than judge them about it. If you're open about talking about it. And then let's talk about the inpatient hospitalization process a little bit, just so we can do that, because it's going to be really frustrating for a lot of people. I've seen this over and over, where people are often not able to get the help that they need, either from not recognizing it, or it just sometimes snowballs so fast out of control that their first point of contact with a mental health professional is in the emergency department with a social worker who is now doing an assessment to determine if you meet inpatient criteria. Are you a threat to yourself or others?
Which, by the way, I really do want to address this, because when I went through it, I finally talked to my daughter, and she said, I'm scared and I need help. Yes. I tried to call, couldn't get help. So I called primary care. We can't see you. I called Instacare. We don't see for this. Take her to the inpatient. Took her to the inpatient. She's 17. We don't see minors. Take her to the minors. Take her to the minor. They don't take walk-ins. 5th place I went in one day trying to find help for my daughter, who was on the ledge, was the emergency department on a Friday. Yeah. You're right. The caseworker, whoever comes in, does an assessment and says, well, we can't do anything for this. The doctor says, we can't do anything for this. She can get an appointment next week to see a counselor. I said, well, we're here now because she needs treatment now.
Yeah.
Is there anything you can do? Well, we could maybe give her medication to hold her over through the week. And that's what we got, and we left. And it just I felt really upset. And I felt defeated because I was at the point I was reaching out for help, and I felt like, you're out there drowning and nobody's throwing you a raft. They're just like, can't help you. Can't help you. And you're like, please, like, we're drowning.
Yeah.
So how do we get that help at that moment? Because again, I have had about 3 people in the last month call me and say, I need to get my kids seen. Like, I need them in now. Yeah. They haven't attempted suicide. They're not threatening to kill themselves or anyone else, but I know they need help. How do I get them in a facility? And I don't know what to tell them.
Yeah. My boat is full. Go swim over to that boat. I can't take you over to it. You got to swim over to it. Oh, when you get over to that boat, you're too young to get into our boat, right?
Yeah.
Go swim to the next boat.
I've never been more defeated.
Yeah. And it is a real limitation in our field, something that we're constantly looking at better ways to do it. I can't speak for the Salt Lake Valley because I don't work up here, and I can't speak for every individual mental health place, I know at Wasatch Behavioral Health, just last year, mind you, they've been open for 50 years. Just last year, they set up what's called a receiving center where anybody could go, regardless of insurance, and spend a couple of hours, maybe talk to a therapist, maybe just get away from the situation that is causing the stress. There are statistics that show that most suicide attempts happen very quickly. If you can make it past a half hour or an hour, your chances of not attempting increase dramatically. So if you can go
getting
be in a
through
safe
the moment.
place. And emergency departments and inpatient hospitalization have a very high threshold of what qualifies to be here.
Right.
They really do see the sickest of the sick in those moments. And if there's a way to address it at a lower level of care, i.e., can somebody stay home with this person and watch them for the next 12 hours, they're going to defer to that most of the time. It really comes down to the knowing what to say in those moments. Yes, I'm suicidal. Yes, I have a plan. No, I don't think I can be safe at home. I need to be in a place that I don't have access to those things and maybe separated from my family right now because I don't trust them to keep me safe either. They're part of the problem most of the time.
Yeah.
Not to parent shame.
Thanks a lot.
They're human, right?
We only know what we know.
Just that human interaction, the projection that happens, whether it's something that you're doing or not, they might be projecting their inner turmoil on the relationships, on the...
So if we know somebody's in trouble, we can't get them to a safe place, and the safe place is with us. What are some things to say? What are things that are helpful in that moment?
Really stepping back and trying to take a non-judgmental approach to understanding what they're experiencing from a compassionate curiosity perspective, sitting back and saying, hey, let's talk about this. If you want to get mad at me, letting them, not escalating or defending yourself from it.
Physically, anyway.
Right. Of course you're going to restrain somebody who's coming at you with a knife, and that unfortunately does happen. At that point, if something like that did happen, you would be calling the police and having additional assistance, because then they can do an involuntary admission to the hospital.
Right.
Because now they are an imminent threat to you or others. If it's their depression that's the imminent threat and they don't actually have a plan, but they're just thinking about it and it just can't leave their mind. It's this intrusive, compulsive thought that they just can't think of anything else, or their life is over, they're worthless, or I'm worthless, I'm the one struggling with this. Just holding that space for them, letting them get mad about life and the situations, and just really trying to be compassionate and understanding. And if you can go to that place mentally yourself to imagine what it would take for you to feel like wanting to die because your emotions are so intense, that will help you to be able to just be with them, and it really is huge, if they feel heard, if they feel understand. But I'm going to tell you, this is easy to say, right? Way harder to do. And that person that you're doing it with is way more likely to slam the door on you. I don't want to talk. Leave me alone. Get out of my face. Those types of things.
Right.
It's a tough balance.
Well, what I loved about inpatient care is knowing that they're pretty safe and watched over. And then we did day treatment for a month, and she learned some really good coping things that she came out, like radical acceptance. And I was like, wow, I really love this. This is great. And quite a few things. And they taught us ways to talk to them too. On a scale of 1 to 10, are you feeling suicidal?
Mm-hmm.
What number? None, or 7 or 8. On a scale of 1 to 10, are you happy? And we did this the other day. She's been seeing this counselor, and this lady's an older lady, an old grandma type lady. And when we first met, she's just like, huh. And, we were in the first appointment, but she's been going for a year.
Good for her.
And she goes about twice a month. And we asked, hey, if we were to pull you from counseling on a scale of 1 to 10, what would your thoughts be? Like 10, this is really bad. 1, yeah, fine. And she was like a 9. That I need this count. And we had no idea. So just to kind of put that in there, because we thought, are we kind of making her see this lady? Is she getting anything out of it? And we didn't realize that this means a lot to her, and it's really important. So I think sometimes keeping the pulse, right? Yeah. And asking the scale.
Great recommendations for sure. I'm so glad to hear, that she found somebody that she can connect with.
Yeah.
And sees the value in it. I think that those things are hard to do. She's accepted that she needs help. She is getting the help, found somebody now after that difficult process of now we can actually have regular appointments.
Right.
It's not a 3-month wait to get in anymore. Mm-hmm. And I see the value in this. This is helping me. This is, and it is very important to work with a professional for a couple of reasons. The professional can see you in a way that your parents will never see you. They can let you have your stuff and not get mad at you for whatever comes up with your grades or your drugs or your, partners or whatever that, whatever that is. They can just be there with you and help you work on it, work your goals through it. A parent can't do that. We would love to be able to do that. We can't.
We're too close.
We're too close. We have a different perspective. We want them to have the world.
Right.
And
they know our background and our expectations. Yep. And when they don't reach that or have different ideas or views, they know that the information they're telling us is disappointing. And so they don't want to share it.
Yeah.
Because it hurts us. Even if we say we accept you and love you, they know, they're smart enough to know it hurts.
And they're going to be judged. If it hurts, it's because they're being judged about it.
Yeah. So the counseling has been really good.
Can I go back to the counselor a little bit?
Yeah, let's go back.
Sometimes you don't find the right counselor first off. She might not have connected with her. There might have been too much of a generational gap.
Well, there was a bad counselor. The first time we went for 4, maybe 6 weeks, and she said, this is a joke. I don't want to go to this counselor. I'm telling them what they want to hear. I'm not learning anything. Get me out of here. And so, it's like, well, we don't want to waste that counselor's time or her time. So we did get her out of there. But, we weren't sure that was going to be all the counselors.
Right. Validate that, Yeah, cool. Thanks for telling me. I am so glad that we are not taking you to this person if it's not going to be helpful for you. Mm-hmm. I want to find something that's helpful for you. Can we try a different person? Maybe different styles. There's lots of different types of therapy. There's some therapists that'll just go and walk with you as you talk and go on hikes with you. There's some that'll do it over Zoom or over the internet, right?
I think this is a really good point, Clint, because sometimes we think that one size fits all. And if we go to somebody and we're not getting better, or we're not learning, or our loved one isn't, then it must just be bad.
Right.
So what you're saying is, if you're not feeling or getting what you need from one counselor or one way of therapy, try something else.
Yes. And it has been really interesting in my line of work because I have worked with people that I wouldn't trust personally. And that's saying something, but what I found out was that's about me. That's not about that person. I've had other people come to me and tell me they were the best person to work with. And when I heard that, I really just step back and go, that is really interesting, because I wouldn't have felt that same way. So it's not about that person. It was about me the whole time, and really testing the waters and working with a bunch of different people can be really helpful. Might be a different gender, it might be a different age group, it might be a different spiritual background, or there's a lot of our community who struggle with spiritual issues, religion issues, gender identity issues, homosexuality, and there is a wide range of people that are going to bring their different background to that therapy session and be able to meet with them on their level.
Right.
And it's really important. And it's really important as loved ones, especially the communities that may be a little on the fringe, that may be not in our own belief system, to really open up to their experience as opposed to projecting yours onto them.
Yeah, and we click with different people. We all have our favorite teacher. We all have our favorite subject, and I think that that's a really good point. And sometimes it's not what you think it's going to be.
Yeah.
I did not think that she would click with this grandma, who just you walk in and you're like, where are the cookies? And you just don't think that she's going to click with your 14, 15-year-old daughter who's,
Cookies, I'm thinking like hard stuck together candy. That was my grandma experience.
Yeah, but it's been really great.
Good. And I think that that's really key. I know that when people are in that position, they're really dark in their mind, and they really don't believe anything could work for them. And it's just not true. I love when I find things that I previously believed and find out that it's not true. For me, that has been something that I have grown to just really enjoy. I find that fascinating.
Like, I can't believe I was wrong about that. That's
so
cool.
Exactly. And, I'm certainly prideful and get cocky, and there are a lot of things that I believe are true, and I've had to unlearn a lot of things. And so if you can bring that spirit with the people that you're with, I've had to unlearn things. I've had to challenge my own reality. Hasn't not always been what it is. So. Well,
here's a challenge, and something that we've also struggled with is medication.
Yes.
Okay. I mean, for adults, for kids, when we started noticing these issues, and I said, I'm going to get you on the right medication. There's also this big stigma around medication that means now you're going to be addicted to it. It's going to cause problems. And I remember my mom, I love her to death. Bless her heart. You can say whatever you want if you say bless her heart. She's like, I don't want my girls on medication.
Yeah.
And I said, I want my girls alive, and I'll do whatever it takes.
Yeah.
And if it means medication, it means medication. What are your thoughts on that for people kind of in the same situation? Like, I don't want to get them hooked on something. I don't want to get them addicted to something. Yeah. Is this going to be worse? Is this going to take them to steal their personalities?
Yeah.
How do we address the medication for mental health?
Huge question. Lots of stuff there. And I'm going to add one more thing on top of it is we've all seen a commercial, and 45 seconds out of the 60-second commercial is listing all the bad things that could happen with the medication.
May cause death.
Yes.
Right.
And especially with antidepressants. They have black box warning of increased suicidal thoughts. It's rare. The percentage is super, super low. But you need to be aware of it. And so this is where I would say go back to the person, identify their goals. They want, they're willing. Maybe they don't want to be on medication, but they're willing to take medication because they want to feel better.
That's why I take my Geritol.
Right. Finding that goal that they have that you're reaching through medication management, because you're not just doing medication management to manage their mood. You're doing it so that they can reach their goal of feeling better. And
so when you associate medication with goals and happiness instead of this is something you have to do.
Yeah. Changes the whole discussion, right? Okay. And that's with a lot of these things. We have the term motivational interviewing, and we do this a lot in addiction medicine and other types of mental health. But what is your goal? How do we get to that goal? Is medication management a part of that? Maybe, maybe not. Studies show that therapy is very effective. Studies show that medication is very effective. Both together are more effective than either alone.
Right.
And they're not the only part of the equation. The lifestyle, the sleep, the exercise, the everything else that goes into it, and so just making it just a normal part of conversation. And if there is somebody that is like, I don't want my kids on medication, respecting that while also being willing to kind of challenge it. Oh, really? You've never taken a medication in your life? You've never taken a Tylenol for a headache? You would not put your kid on insulin if they had diabetes? What if they had a seizure disorder? It's a brain disorder. That's a mental health thing.
Right.
Would you put them on seizure medications to save their life?
Mm-hmm.
If they say no, okay, that's not about you, right? That's about them.
Yeah, but you're challenging their thought process too.
Yeah, you're changing it, right?
Well, because most often people think mental health is almost just made up. If you're happy, you're happy. If your life is good, you should be happy. There should be no sadness. Should be. And I think, even though sometimes we know the difference, like I know the difference. My husband, military vet, former law enforcement, has PTSD. And I know like he takes medication, and there's part of me sometimes that thinks, well, you're happy now. Like we have a great life. Maybe you don't need that anymore. But it's not about that.
Yeah.
You know what I mean? It's shifting that mindset that happiness doesn't always equal my mental health is better, because it's a brain issue, right?
Yeah, and a lot of people will use the term chemical imbalance, which is not really true. It's just one of the ways that we can kind of conceptualize what's going on.
Okay.
And we do work on some of the neurotransmitters with medications, serotonin, dopamine, norepinephrine, things that make you feel calmer, happier. We manipulate those with medications to, help you adjust to what you're feeling in a way that is more tolerable. When I was a teenager, I felt emotions so strongly. I can still feel strong emotions, but they just aren't as intense or as rapidly shifting as when I was a teenager. A lot of that had to do with hormones at the time, right? My perception of the world at the time. And so they're a very unique group of people. Mm-hmm. Their metabolism is super quick. You give them a medication, their body's going to get rid of it, sometimes faster than it can work. And so they often need higher doses of medications, which is scary as a parent.
Right.
Wow, this seems like a high dose, or multiple medications. I only want them on one Isn't there one pill that will work?
Right.
Rarely. Sometimes it does happen. It's rare. But they're also very sensitive to medications. They're more likely to experience side effects. Most side effects are tolerable. You might feel off, maybe a headache, maybe some GI distress. It might interfere with your appetite or your energy level. Some are very serious and really need to be taken seriously. So as you're going through that process with a loved one, doing those check-ins, starting with, is this medication tolerable? Are you at least tolerating it? If you're tolerating it, we don't see any good, we don't see any bad, then okay, cool. We can continue down this road. Now we find a dose that has some benefit or isn't tolerable anymore. One of those two things is probably going to happen.
Right.
And sometimes they don't work. And that's a really frustrating thing, because when you're manipulating the neurotransmitters, it takes a long time. You do not want to do that fast. It generally ends up worse if you rush things, but we feel this way now. We want it taken care of now. And we live in a world society where, geez, I can get almost anything I order off the internet. How soon? Quick, right?
Yeah.
So it's tough. And telling somebody who is in that state to have patience, to believe that it's going to work, is tough. So having their buy-in is one of the most important things, because if they believe it's going to work, it's way more likely to work.
Yeah. Clint, there is a fear from a lot of people that if I go get help or see someone for mental health, what are the consequences?
Yeah. A lot of people are afraid that, hey, if I open up about who I truly am, my thoughts, then I'll go to the hospital. They'll force me to the hospital, right? They'll lock me away forever, and that fear is real, but the reality is not the same as the fear. We talked about how difficult it was to get into the hospital.
Yeah. You can't get in there if you want to.
Yes. And that's usually more the reality. Before you've gone down a path, it's hard to see what that path looks like. And the fear of being hospitalized, first off, that is something that somebody's going to have to overcome. And so it's going to have to take a lot of trust in who they're working with. And if you were a person dealing with that fear, I would be very upfront about that with the therapist or with the prescriber. It's not something that people always bring up with me. It's not something that I always bring up with them, but I try to cover it. When I think about it during our visits, I'm like, hey, for what it's worth, I don't want you inpatient. We haven't talked about that, but I want you to know that I don't want you inpatient. If we need to go that route, it can be very helpful.
What about even seeing a counselor? Does that go on your record? Mental health problems.
There are very few jobs people would be unable to get if they had an exposed mental health record. Most of the population will never run into this. If you had a highly classified job with the government where they might look into that, or if you were going into the armed forces and stuff like that, it doesn't automatically disqualify you, but they want to know that you got the treatment that you needed and that you'll be safe for the job that you're going to be put up for.
Right.
So if that applies to you, you probably shouldn't do that job anyway. So, fair. I mean, I know that it's easy to talk about from this perspective as opposed to I'm experiencing this fear.
Right.
But it is. You're making a choice based off of fear, but that fear is not based in reality.
And I also think that, things have come around. People have changed. Ideas have changed. There might have been a heavier stigma maybe 10, 20, 30, 50 years ago for seeing a counselor and mental health and any of this stuff, where today we go, it's okay. It's okay to do that. And maybe the judgments aren't there like they used to be.
Yeah, because if you take it from the perspective of you're getting help, that's what they want. They don't want somebody in that role who has had these mental health issues that didn't get the help.
Yeah.
They want the people in there that are stable and doing well, emotionally. And there are things that people who go through mental illness, that they learn, their coping skills, the things that you brought up, radical acceptance, I didn't learn about that until I was way older. If I would have learned about that as a teenager, that would have put me way ahead.
Right.
Right? And I don't know that I ever would have learned that if I hadn't gone to therapy or gone inpatient.
Yeah.
You know, we often look at these things as such a negative perspective towards what our life is going to be like. The truth is, we're supposed to have challenges because they help us learn from life. And if one of those challenges is needing to go inpatient, what can you learn from that experience that's actually going to help you in whatever it is you're going to be doing? You know, I've seen doctors go inpatient. They're either really great patients or they're not so great patients. Nurses are probably the worst,
right.
You know. But it's not going to prevent them from being a doctor, you know. There's a doctor we learn about in schooling as we study mental health. And all right, if I, you know, kind of talk about her a little bit. Her name's Patricia Deegan, and she developed the voices training that mental health professionals go through so we can understand, relate to somebody who is experiencing voices, auditory hallucination, psychosis. Her backstory is that she had a really rough time as a teenager with lots of psychosis, lots of medication, inpatient hospitalizations. She's a doctor.
That goes back to the research, right?
Right.
Usually there's something in our core that drives us to where we are because we're looking for answers. We're searching for help.
Yeah.
And then once we figure that out, like, where's the purpose in my pain? If I'm going to go through all this and I learned so much, how can I help other people?
Right.
I love that she's doing that.
Yeah. And it's super helpful. You know, it really is helpful to have people have these experiences. As much as we want to avoid them for ourselves and our loved ones, there is dignity in failure. It's one of the things that she talks about. It's okay to fail. There's dignity in that. You know, you learned, you chose your path, and you shouldn't always be happy. That would be weird.
It's fake.
Right? That would be weird. You should have trials, tribulations, difficulties, because that's what makes you stronger. You know, you want to actually set some of those up in a safe way for your kids, you know, as they're growing up, so that they learn how to ride a bike.
Yeah.
Yeah, they're going to wreck. They're going to get a skinned knee. They're going to come in crying a couple of times. They're going to have to learn to wear their helmet because they're not going to want to wear their helmet until they've learned that I need to do that.
Yeah.
You know, and those are the things that we need all throughout life. We get really good at staying in our comfort zone and not allowing ourselves to have difficulty. But one of the biggest challenges can be try it. I really challenge anybody out there who wants to. This was one of the hardest New Year's resolutions I ever tried to do. Mm-hmm. Fail more often. Try to set up failures in your life.
I don't have to try.
Good luck. It's hard though. Like if you're trying, you know, but really, are they failures or are they just, okay, that didn't work?
Right. And I mean, it's true. It is true. It's like when you grow the most and you think back, it's when you had challenges and when you failed and you had to work through something and reconcile it and learn to do it differently or problem solve. Yeah. It is easy to get comfortable, but comfortable, I think, isn't true happiness.
Yeah. It's a dangerous area.
It is. There's so much that we could be talking about. I appreciate your insight and your knowledge. Is there one final thought that you want to leave with our viewers and listeners?
The takeaway that I would hope anybody would get is to work on yourself first. If you have somebody in your life that is dealing with stuff, work on yourself. Model the behavior that you want them to emulate, right? If I was going to tell my kid, hey, you need to take this medication, then they need to know that I would be willing to do that too.
Right.
You know, hey, you need to go to therapy. That's hard to say if you've never gone to therapy, right? And so really working on yourself is super important. Being open to that and getting through that self-stigma of I need to do my work, because I promise we do. All of us do. And if you do that, it'll make these other things that you're going to deal with so much easier, because it won't be about you anymore.
So the whole do as I say, not as I do is garbage.
Yes.
Do as I do.
Do as I do. Yeah.
And be that person to set that example.
Yeah.
And don't be afraid to reach out. Thank you so much, Clint Peterson, for joining us from Wasatch Behavioral Health. Amazing information. And, you know, if you guys are looking for good treatment, check out Wasatch Behavioral Health.
Sure.
Thank you.
Thanks for tuning in to Mental Health Helps. If you're an expert or you have a story you would like to share, please reach out to us at gooddeedrevolution.org.